Ever wondered why your ears feel like they're under siege? Let's dive into the world of ear infections. Understanding ear infections is crucial for your overall health. In this video, we'll explore the causes, symptoms, types, diagnosis, and treatments for ear infections, empowering you to take control of your ear health. We'll also delve into some effective home remedies you can try for relief. An ear infection, also known as otitis media, is an inflammation or infection of the middle ear, the air-filled space behind the eardrum. It's incredibly common, especially among children, but adults can experience it too. You see, the middle ear is connected to the back of the throat by a tiny passage called the eustachian tube. This tube helps regulate pressure and drain fluids. When this tube gets blocked or inflamed, fluids can build up, creating a breeding ground for bacteria and viruses. This leads to the pain, pressure, and discomfort we associate with ear infections. It's vital to understand ear infections because they can significantly impact your hearing, sleep, and overall well-being. Think of your ear like a delicate ecosystem. When it's functioning correctly, everything is in balance. But when an infection strikes, it disrupts this balance, causing a cascade of uncomfortable symptoms. We'll dive deeper into those symptoms in just a bit. But first, let's explore what causes this delicate ecosystem to go haywire. Understanding the causes of ear infections is the first step to prevention and effective treatment. Ear infections can stem from various sources. One of the most common culprits is the common cold. When you have a cold, the viruses can travel up the eustachian tube, causing inflammation and blockage. Allergies can also trigger ear infections. When your immune system overreacts to allergens like pollen or dust mites, it can lead to inflammation in the nasal passages and eustachian tubes, increasing the risk of infection. Another significant contributor is smoking. The harmful chemicals in cigarette smoke irritate the eustachian tubes, making them more susceptible to inflammation and blockage. Even secondhand smoke can have a detrimental effect, especially on young children. And let's not forget about bacteria. While viruses are often the initial invaders, bacteria can take advantage of the weakened defenses and cause a secondary bacterial infection, further complicating the situation. Ear infections often announce themselves with a symphony of discomfort. One of the most telltale signs is ear pain, ranging from a dull ache to a sharp stabbing sensation. This pain is often worse at night when lying down, as the fluid pressure in the ear increases. Another common symptom is a feeling of fullness or pressure in the ear, like something is stuck inside. This can be accompanied by muffled hearing, as if you're underwater. Fever is also frequently present, indicating your body's fighting off the infection. The fever can range from mild to high, depending on the severity of the infection. In young children, fever may be the most prominent symptom, as they might not be able to communicate their ear pain effectively. Other symptoms that can accompany ear infections include drainage from the ear, irritability, difficulty sleeping, and loss of appetite. Ear infections aren't one size fits all. They can manifest in different forms, each with its own set of characteristics. The most common type is acute otitis media, or AOM. This is the classic ear infection, characterized by a rapid onset of symptoms like ear pain, fever, and fluid buildup in the middle ear. Another type is otitis media with effusion, often referred to as glue ear. In this case, fluid persists in the middle ear even after the infection has cleared. This can cause muffled hearing and a feeling of fullness, but usually without pain. Then there's chronic otitis media, a long-lasting inflammation or infection of the middle ear. This can lead to repeated episodes of AOM, persistent fluid buildup, and even damage to the eardrum or middle ear structures. Understanding the different types of ear infections is crucial for determining the appropriate treatment approach. Each type requires a specific strategy to address the underlying cause and prevent complications. Diagnosing an ear infection starts with a thorough medical history and physical examination. Your healthcare provider will ask about your symptoms, including the duration and severity of ear pain, fever, and any other accompanying issues. They'll also examine your ears using a specialized instrument called an otoscope. The otoscope allows them to visualize the eardrum, looking for signs of inflammation, fluid buildup, or bulging. In some cases, a pneumatic otoscope, which puffs air into the ear canal, might be used to assess the eardrum's mobility. If the diagnosis is unclear or more information is needed, further tests might be ordered. These could include a tympanometry, which measures the eardrum's movement in response to pressure changes, or an acoustic reflectometry, which assesses the amount of fluid in the middle ear. Accurate diagnosis is essential to ensure the right treatment plan is implemented, preventing complications and promoting effective healing. Treating ear infections involves a multifaceted approach tailored to the specific type and severity of the infection. In many cases, the body's immune system can fight off the infection on its own, especially in mild cases of AOM. In these instances, pain management and watchful waiting might be the initial strategy, allowing the infection to run its course. However, if the infection is severe, persistent, or accompanied by high fever, antibiotics might be necessary to combat the bacterial overgrowth. Your healthcare provider will determine the appropriate antibiotic and dosage based on your individual needs. It's crucial to complete the full course of antibiotics as prescribed, even if symptoms improve, to ensure the infection is fully eradicated and prevent antibiotic resistance. Alongside medical treatments, several at-home remedies can provide relief from ear infection symptoms. We'll delve into these home remedies in the next chapter, offering practical tips you can implement for comfort and support. Remember, while home remedies can be helpful, they should not replace professional medical advice. If you suspect you or your child has an ear infection, consult a healthcare provider for proper diagnosis and treatment. While it's crucial to consult a doctor for diagnosis and treatment, certain home remedies can offer relief from ear infection discomfort. One of the simplest yet effective methods is applying a warm compress to the affected ear. The warmth helps soothe pain and reduce inflammation. You can use a warm washcloth, heating pad set on low, or a hot water bottle wrapped in a towel. Elevating the head can also make a difference. When you lie flat, fluid can build up in the ear, increasing pressure and pain. Propping yourself up with an extra pillow or two can facilitate drainage and alleviate discomfort, especially at night. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage pain and fever. Always follow the recommended dosage instructions and consult a doctor if you have any concerns or underlying health conditions. Another helpful remedy is gargling with warm salt water. This can help clear the eustachian tubes and reduce inflammation in the throat, indirectly easing ear discomfort. Simply dissolve half a teaspoon of salt in a glass of warm water and gargle for 30 seconds, repeating several times a day. Remember, these home remedies offer supportive care, but they shouldn't replace professional medical advice. If you suspect an ear infection, always consult a healthcare provider for proper diagnosis and treatment. We've covered the ins and outs of ear infections, from their causes and symptoms to diagnosis and treatment. Remember, understanding these aspects empowers you to take control of your ear health. Early recognition and prompt treatment are key to preventing complications and promoting effective healing. If you suspect you or your child has an ear infection, don't hesitate to consult a healthcare provider. They can provide an accurate diagnosis, recommend the appropriate treatment, and offer guidance on managing symptoms. Your ear health is essential to your overall well-being, so prioritize it and seek professional care when needed. Thanks for joining me on this deep dive into the world of ear infections. If you found this video helpful, give it a thumbs up, subscribe to the channel for more informative content, and share your experiences or questions about ear infections in the comments below. Your insights can help others navigate this common health concern.